Welcome back to Conversations with Dental Friends, the podcast that dives deep into what it really means to build a fulfilling and positive career in dentistry. This week, I'm joined by the brilliant Ursula Molloy, a dental therapist at Healthadontic Dental Practice in Bangor. Her story is a powerful reminder of what's possible when we stop playing small. After years of being boxed into a predominantly hygiene role, Ursula made a bold move. With the backing of an incredibly supportive practice, she stepped into her full scope of practice and hasn't looked back since. As a dental therapist myself, I find Ursula's story incredibly empowering. She didn't just accept the limits placed on her, she challenged them, upskilled, and completely transformed her career. So whether you're a dental therapist feeling stuck in a hygiene-heavy role, or a practice principal wondering how to better utilise your team's full potential, this episode is packed with insight, inspiration, and real talk. Let's get into it. Hello, Ursula.
Hello.
Welcome to Conversations with Dental Friends. Thank you so much for being part of this podcast. It means so much to me that you're on. Ursula and I know each other mostly through BSDHT, mostly through the British Society for Dental Hygienists, Dental Therapists. Ursula was part of our speaker programme very recently and she did a fantastic job.
Thanks.
And I felt that Ursula has so many fab insights to give to us as part of this podcast. And I can't wait. I'm so excited.
Thank you.
Ursula, let's start at the beginning. How did you find your way into the world of dental therapy? Was this always the plan or did you take a bit of a detour along the way?
No, I took a massive detour, a huge detour. So I was sitting on my bus going into upper sixth, fully prepared that I've done my A-levels and I'm going to be a teacher.
Okay.
And I was looking out the window thinking, I don't want to be a teacher. Oh, Lord, I don't want to. And it genuinely
This isn't for me.
So I did it. Went on ahead.
So you did the training and everything?
Did the training, went and finished my A-levels and took the most direct route that I could find to the Holy Lands. Yes. And that's the honesty. I needed escape.
I love that.
I wanted a wee bit of freedom. And that was, I'm just be perfectly honest, that I did a degree in history because it was the path of least resistance.
Yes.
And then qualified and got my degree and came home having started teacher training and announced to my parents with much delight that I don't want to be a teacher.
This is not for me.
I don't want to.
So you started your teacher training in Belfast as well?
Yeah. And I just wasn't thriving in that environment. But I didn't know what I wanted to do. I had so many ideas of what I want, and then I thought I'll travel. No, I'll not travel. I'll do this, and I sort of fell into dental nursing because I was applying for jobs, and I was either overqualified with a degree or underqualified because I didn't have a master's, and it just sounds clear to be. So I went down the dental nurse route because human biology was always a strong suit of me.
Yes. What were your A-levels that you
did? My A-levels were strangely history, politics, religion, and then biology and chemistry.
Oh my goodness, so you're racking them up.
It's not that they were easy A-levels, but they were easier for me, and I found them easier.
Yeah.
And I just managed to get through it. But ended up dental nursing and went into the course in Belfast Met. It was Biffy at the time.
Yes.
It's a long time ago.
I remember that Biffy, yes.
And it was run under Rosemary Gervin, who was lovely. She was brilliant and she was fantastic, and she would have recognised that you maybe were able for a bit more. And very much Rosemary was one of my first pushes towards hygiene and therapy.
Amazing from that outset. From that dental nursing place. Very good. And how did you find dental nursing when you were nursing then?
I loved it.
Yeah.
I really loved it. And I liked being in charge of my surgery. I liked that control. Yes. I liked that. And I worked with lovely dentists. I was over in Thankyou Dental, and that was with Joe Scullion, and Paul McKenna was the associate there that I worked mainly with. And they were lovely. It was supportive and a really, really nice team to work in. And very much supportive of progression.
Yeah.
So they weren't gatekeeping anything, and they weren't...
They didn't want to hold on to you too tight.
Not too tight.
Yes.
They didn't want me to go.
Of course they didn't. Herself. Yes.
But they very, very supportive of progression within your career and get on with it and do it. And even during my training when I was in Leeds, I came back and did my clinical observations in Thankyou, because
That's
it was just
lovely.
nice to come home and do that.
It felt like a full circle moment,
Yeah.
maybe.
And it was maybe easier for the likes of me, because I trained over in Leeds, and you were sort of a wee bit of a fish out of water on your own. And everybody was brilliant. But it was just nice to come home for them couple of weeks and not have to stay.
So you went to Leeds. What year did you go?
2009.
2009 you went to Leeds then, and you had lived in Belfast before, but that's making a big leap. And I felt that myself as well, going from living in Belfast to, I was in northeast of England, not too far away from Leeds and Newcastle. But it's definitely a big decision.
It's a big decision. And I was mid late 20s whenever I qualified, so I was getting on in life, like, and it was a huge decision to make.
Yes,
to quit your job. You have your income and you have your car to pay for and everything else. Quit the job, no income, and start into student loans again, and take yourself off to Leeds for the best part of 4 years.
Absolutely. I felt like whenever we went to uni in our little cohort of 10, and at the beginning it felt a bit like a boarding school. And I remember one of the girls in the year above saying, we've all given up jobs to be here. We want to be here. We're going to turn up.
Exactly.
We're not going to mess around. We're here for a purpose. And I think that kind of training of having that little bit of the dip the toe in the pool and have that dental career before of a dental nurse. You are there you're in Leeds for a reason, and you're getting it done.
Yeah.
So you were there for 4 years then.
So on and off, I've been back and forth working in once I qualified, so I took a few jobs back in Leeds.
Did you?
Just very briefly, just cover and maternity covers and things, just to get income.
That's brilliant. How did you find working in Leeds?
A lot different to working here.
Yes.
It wouldn't have been for me purely because I'm a homebird.
Yes.
And I just wanted back in home.
I'm the same. I'm the same. I didn't spend any time working there, but part of me kind of wishes I had, in a way, because
just tried it.
It's a chance that I'll probably not get now to do. So it's nice to have that.
Yes. But I like what you said about once I'm going back to university the second time, you're not going to mess about.
No.
And that was very much my headspace.
Then you qualified in Leeds, and you're now still working at Healthadontic.
Yes.
And you're using your full scope of practice as a dental therapist, which for dental therapists, that has to be celebrated. That's very exciting for us as dental therapists. But for anyone listening who might not be familiar with what that actually means, can you break it down? What does a day look like for you as a dental therapist?
So at Healthadontic, it's very much whole health focused. So Emma Prentice is the practice principal, and she's just brilliant. And her vision is that we're not treating just the mouth. We're not looking at just the mouth. We're looking at this patient as a whole and treating him as such. So my day is really varied. It can be therapy-led exam where I'm almost presenting to Emma. Our exam appointments will be booked side by side.
Right.
If the patient needs radiographs, then I'm taking that. I'm doing my exam as a therapist. And then anything that's beyond my scope, I'll be looking and saying, look, this crown, I don't like the look of this, or look on x-ray.
So how does that actually work? So you and Emma work side by side, really, into surgery, and then you send the bat signal. Do you send like an instant message, and then Emma will come through?
So on our day list, the patient would be booked in on both of our day lists. So Emma will know who's booked in for exam and which patient's in with me for exam and for their periodontal assessment. And it'll just very much be coming in and out of each other's surgery and just back and forth. And I like that. I like that team approach, because as much as I'm using my full scope of practice now, it has taken time to work up to that, because I was very much a hygienist.
Yes.
And on that, I'm trying to talk about the hygiene treadmill for years, and it's hard to get off that.
It is.
Because you have to remember to, and I had to sort of remind myself, you have to earn here. This is, you have bills to pay. This is not just, as much as I want it to be my ideal career,
It's not a playground.
It's not a playground, and you have to put the time in. And sometimes take jobs that maybe you're thinking, I'm going to be here and I'm not going to get any therapy work,
but I'm going to get paid.
I'm going to get paid. And that is reality. And I was so lucky to find to find Emma and to find, you know, a home in health context.
So she was really on board from
Very much so.
from the beginning then.
Yeah, so.
And so how long have you been working at Healthadontic using your scope of practice?
What am I there? 4 years coming.
Brilliant.
Yeah.
Brilliant. So that's a scary place to come from, working mostly as a dental hygienist, and then you made that leap and you went to Healthadontic there. And so your day at the minute, you have your exams.
I'll have exams. I'll have maybe restorative treatment. I'll have my periodontal assessments and then periodontal treatment. And it is broken down. It's very much we're following the STEP guideline. Patients are very well attuned now, and they've got used to me, and they know that they're going to be well educated.
Yes.
And you're going to love that one before you get to step 2.
Oh, I am such a big believer in the steps, the STEP programme. I love it.
Emma's very much on board with that. This has to start at home. It's not just about fixing teeth, which we can do, you know, but what are we doing to stop this? What are we doing to address the cause of this? What are we doing to prevent it? And is it solely what's going on in the mouth? Are there systemic problems? Are there other medications on board? Is this patient more complex? And what additional needs do they have? So even a restorative appointment, it may branch into something else.
Yes.
Am I right to put a composite into this tooth when these gums are inflamed? No. So that patient will be re-educated and brought back into periodontal health before that filling, unless they're in pain, obviously. Yes. That's relieved. But before we run down the path of let's just make everything look pretty, so we're going to sort your health first and we're going to stabilise everything.
The foundation will be there.
It has to be there, and that's definitely Emma's approach. And I love that.
And yours as well, of course. Yeah. And would your diary be pretty much 50-50 restorative?
Would be 50-50.
I love that. And that's such a brilliant achievement to be able to get there and have that team support is of course absolutely essential. Ursula, coming straight out of uni into dental therapy can feel a bit like you're completely thrown in at the deep end. That's how I felt 100% whenever I came out. And I know you've done a lot of postgrad training to build your confidence and really step into that role. Can you talk us through some of the courses you've done and how they've helped you level up?
A lot of therapy-based courses. So I looked for anything that would accept a therapist.
Yes.
Which isn't...
Not everything.
Everything. And you do have to accept that you're probably going to book onto a course where some of it isn't clear for you. So you take what you can from it. So a lot of my early courses where I was going to say the likes of composite restorative courses, and I went back and forth in them. There was a couple in Manchester I went to. They weren't really aimed at me. They weren't really aimed at therapists. It was a wee bit of restorative treatment, but it was more crowns and on-laser bridges and things like that. Yes. So it sort of was a wee tiny bit disheartening, but that was my own fault. Booking on it.
Yes, it was the illness.
Yeah. So for me, it would be looking at courses that gave me a good balance of even some perio, some isolation, and some restorative. And occasionally I've got it at the likes of Lauren's.
Yes.
Course was brilliant. His Restore, which was, it gave a bit of everything.
Yes.
And then looking at also purely restorative courses. So I did Monic Vassant's anterior and posterior most.
I'd love to do that one.
Brilliant. It was really, really, really loved it. And that was a big leap for me because I was looking at it. I booked the course and then talked myself out of doing it because I thought, oh God, right now.
And was that at that juncture whenever you were kind of looking to get off that hygiene treadmill and move into therapy? So that was kind of a real... Am I doing this course?
Am I doing it? And at the time, I remember telling Monic Vassant, I haven't lifted a handpiece in about 6 years. And I have to be honest with that, because there's no sense in me sitting panicking, thinking, oh, he's going to think I'm terrible at this. And he was brilliant, and his demonstrators and the associates with him were brilliant because it took a bit of time with therapists. That particular course that I went on was in Belfast, and I was the only therapist there. So I felt really lonely.
Yeah, absolutely.
But I had other dentists there that I knew, and they were chatting away, and so it brought you into the fold, made you feel a bit more at home, and very much Monic and his associates made you feel at home. So that was the big launch pad back into therapy. Yes, it was an expensive course to do, but I found that it was so beneficial to just sit and go back through the steps and do.
And do you get an element of theory with that course? Like, say if you were somebody like myself who hasn't really done any therapy since I'm qualified now, nearly 12 years, and I wouldn't say I've done an awful lot of therapy in the past 8, 9, 10 years, that would be quite a friendly environment for a therapist.
Would be, yeah. There is the theories covered, there's some materials covered as well, because aside from not lifting a handpiece, I hadn't thought about materials. Yes. I haven't been using them. I hadn't thought about etching and bonding because I haven't used this in years.
Yes.
And what do I do next? And the changes in composite as well. There was a fair bit to learn again, because it wasn't just straight old.
I find that with Lauren's course, Restore, it was Lauren Long, Eilish Duffy and Nina Farmer took us through their Restore course here in Belfast in August last year, and the changes in composite were unbelievable. And then whenever you were going through on your materials update that you gave for us with BSDHT, I haven't thought about composite in a long time, really,
isn't it?
You know.
And there'll be more changes, and it is keeping up to date with what to use and where. What you're going to use in an interior tooth may not be the same as you're using.
You're not just picking a shade.
No, there's a wee bit more to it than that. Yeah, getting the best out of the material you're using. So I find that if I'm looking for a course, that's what I want to see. I want to see a wee bit of everything. And very much, I'll talk a lot about isolation, as you know, but that's one of the things that very much helped me develop in terms of skill, confidence, and confidence to provide the best restoration that I can for the patient that's there. Because there's also that wee niggling voice in the back of the head, you're not a dentist.
Yes.
So I sort of would push myself to be as good, not say better, but as good as.
Absolutely.
And really push this and challenge myself to say, look, I want to do what they're doing. And I don't want there to be a difference. I don't want patients to see a difference.
It doesn't want to feel like second tier.
Second tier, yeah.
Any other therapy courses that you've done or looked
Therapy
into?
courses I've done, I did Smile Fast as well, which was on composite bonding, but very much it was mnemonic and working through the anterior and posterior, the maestro classes, the maestro courses. And then with working in orthodontic and got chatting to one of the associates in Naveed, who was really, really helpful because I was so nervous with isolation, and that was one of the things that I was looking for was an isolation course. And couldn't find it. Could find it in England at astronomical prices.
I know.
And it's also bearing in mind that it's the time off,
the travel, the hotel,
everything, the expenses racking up. And there is an element, yes, the therapist will have to be realistic, but we're going to have to spend a wee bit on courses.
You do. For every aspect, I think, post-qualification, if you're not investing in yourself, it is a mistake.
Yeah. And it is, yes, a slower return than a dentist is going to see, but it's more, for me, it's more so about developing and building my confidence. And I'm happy to pay for that.
Yes.
I'm happy to do that. But I was really fortunate that Naveed was there to able basically give us time and was very, very helpful and very kindly give us time.
Yes.
And started off doing simple cases, single tooth isolation, and taking sort of the mystery away.
Yes.
And it was, for me, that was one of the things that I got very flustered with rubber dam and got very worked up and thinking the patient thinks I'm slow with the patient and worrying about silly things.
I haven't put a rubber dam on since my Oskies.
Isn't it mad?
Yeah.
See, I hadn't put a rubber dam on since university. So that was daunting. And it was more just having the confidence to ask for help as well.
Yes.
I would have thought, I can't let on that I'm not confident with this. They're going to think I'm stupid.
Yeah. What else are they going to think that I can't do or won't do? It's that imposter syndrome, isn't it? So that's a lot of learning. Amazing. And I'm sure you've done like lots of little, like the CPD just racks up for us as well, isn't it? Especially now that we can do webinars and there's other little courses here and there that we all go for. But if you were starting fresh, or if you had to pick your favourite, which would be your non-negotiable for doing your best work as a dental therapist?
For me, definitely an isolation course.
Yes.
100%. I was so lucky that I had it in practice, that I was able to learn on a daily basis. And Naveed was there, and as I say, very kind with his time. And that was a game changer, because freeing up your hands, releasing a wee bit of that energy, that it's there, it's fine, the tooth's not going anywhere. And it just gives you time to think. It takes away a lot of the hassle of moisture control.
Yes.
But it purely levels you up, and taking time to focus and get that first step right.
Yes.
the rest of your appointment runs a lot smoother. So for me, if you're going to put a lovely composite in, you need to have the tooth well isolated.
Yes.
If you're going to go down adhesive dentistry or even cosmetic dentistry, isolation has to be right.
I'm a wee bit of a control freak, and it gives you that little bit of control that we're all longing for in any dental procedure that we do. Absolutely. That's so interesting that isolation is where you would start, because I don't think a lot of people start there.
No.
And maybe discredit isolation. I mean, I've worked with some great dentists that haven't been, that I'm sure aren't isolated, and then I have worked with other dentists where that is a complete non-negotiable, where I was certainly in discussions about trying to, at the start of my career, try and do some therapy, and the dentist said to me, "Can you use a rubber dam?" And I was like, "Well, no." And then he was like, "Right, well, you can't do restorative work then." And then I was completely lost, because I wasn't even aware that, and there maybe wasn't at the time, as you were saying, you were looking for that course as well, where there wasn't an option to brush up those skills. And if you don't have a phantom head in practice, and it's not the nicest thing to make your nurse do,
it's not
15 times.
And that's it. If you don't have it in practice, and I'm very fortunate to have it in practice.
Yes.
With my course progression, I've sort of done it back to front.
Yes.
Because I've done the composite first, and there was isolation technique involved in that. But I wanted more.
Yeah.
Because it was more aimed at, well, you're already using this.
Yes, we all know what you're talking about here. Yeah.
Where I was sitting going, actually, no, not. I can get it. Yes, it's all right and easy enough to get it onto a model.
But it's whenever it's on,
When you go to
on a patient,
they're difficult.
That's so good. Ursula, there's a bit of a stereotype that being a dental therapist can feel quite isolated. We're just talking about isolation, but sometimes you can be isolated as a clinician in practice. But I know a lot of people who absolutely thrive in that role. What's been your experience? Have you ever felt like the odd one out, or do you feel like you've carved out your space in the team? Do you think the industry's doing enough in terms of how therapists are integrated into the wider dental world and dental team generally?
I would definitely agree. It is. I find it isolating. I've found a lovely team now, and I found a fabulous home.
Yes.
And the whole team.
And you travel a long way to be there, so it must be worth it.
But yes, I found a lovely home. This is where my heart lies. And it's years of, yes, I did feel very much isolated.
Yes. And hygiene rules as well, I'm sure.
Very much so. Hygienists, I feel, are, when you're in the practice as a hygienist, you're not really included as a team.
No.
I sort of find that with a lot of places. I don't think they're doing it on purpose.
No.
But it sort of ends up, you might only be there 1 day a week or 2 days a week.
Exactly.
You're not an afterthought's too mean, but you're not really thought of as part of the team. And that can be really disheartening. And I find that disheartening because a wee homebody.
Yeah.
I've talked about that.
And you want to feel that family vibe. Family's maybe wrong. I know people describe jobs as family, and actually that's probably the worst way you could describe it, because you don't want your job to be like your family, but you want to have a community.
A community, yes. And sometimes I would have been even like envious nearly of the nurses, because they were all together.
And have their thing going on, and you want to be involved, but then you don't quite fit in with them, but then you don't fit with the dentist either. And you don't fit with the welcome team really either, and everybody gets on.
Yes, but you're not really included. And again, so fortunate that I've found with Heldodontic that that's just not the case from day one. And practice manager Fiona, I have to mention Fiona.
Yeah,
she's just brilliant, and it's very much a community vibe, and you're supported professionally, but there is a bit of support in the background. How are you doing?
You want to have that scaffold there of, especially as a self-employed clinician.
Yeah.
That's very hard for us sometimes, because with employment comes a certain amount of backing around. You have a job security, but you also have like moments where you can go to the office.
Exactly.
And you can have your time and space, and you can talk to somebody. My manager is myself, and if I start talking to myself, I'm in trouble, So it's very hard. And of course, there are practices that will indulge you in your needs, and if you go through difficult periods and things, you would hope that people would be there for you. Yeah. But we are out on our own a bit through self-employment as well.
We are, and I do think there needs to be a bit more done within dentistry as a whole. There still is not stigma, but maybe a wee bit of lack of understanding
Sure.
what a therapist role actually is. And I don't mind people calling me a hygienist, but
you're a therapist.
but I'm a therapist.
And you're doing therapy.
And I wouldn't call a dentist a therapist.
No.
And it's, to me, it's
having that.
creating a wee bit of respect.
Yes.
And again, I don't think that that's a conscious thing. I think it is purely just that it's not been embedded into the education or the training.
And the language.
The language is still a little bit outdated.
Yes.
Very much in Leeds, the whole team was trained. So they trained from nurse right up to consultant and dentist, and then also the dental technician. So we worked in teams.
So everybody knew about
rules.
It nearly makes it a little bit of a mission to make sure that everybody knows what a dental therapist can do, because we can do amazing stuff. Amazing stuff. I think that it is getting better. However, definitely for me, there's been maybe a certain level of acceptance that if I do want to fully utilise my full scope of practice, that means very much changing my day-to-day, because I'm so immersed now in perio and implants and oral health messaging, and that's all very, very important to me. But if somebody is a dental therapist who still wants to embrace their full scope of practice, I think the messaging can be done. You know, you're the poster girl. It doesn't have to be something that, if you haven't lassoed this
not out of reach
on your first couple of years out of practice, it doesn't mean it's over for you.
Exactly.
And for me, definitely one of the reasons I wanted to do the Restore course was in case there was an opportunity that came up, and I wanted to feel prepared.
Exactly.
Because you never know what's in on your path in the future. And I think more practices hopefully will become aware of dental therapy and what that means, and how we can really be such a valuable asset to a team.
It is coming. I do feel that there is more, the more talk there is about it and the more chatter about it, it definitely is. It is something that is developing.
Yes.
And I do feel that this, I don't want to go into generationals, but this generation of sort of dental professional is more open, or seems more open.
Very much to everything.
And dentistry is now becoming more specialised. You know, you have dentists in taking on a specialised role maybe earlier in their careers. And that really is opening the door for therapists as well.
It is.
And it's just having the confidence and the support around you to take that step and not be afraid of that. And there was a time, I'd say maybe about 5-6 years in, that I thought there's definitely no more therapy, and it's done, and just hang the drill up, and I'm never going to get it. And so a wee bit down in the mouth about it. And that's okay, because it's like, if you're experiencing that, maybe you should do something about it.
Yes, exactly. Nobody's going to come knock on your surgery door and say, we all hear those stories of, the dentist fell and broke their wrist and I needed to do all the fillings. But that doesn't happen. It's like Sex in the City, the dating myth. That doesn't happen all the time. You need to say, I want to do this.
I want to do it.
I'm going to do a course. I'm going to invest in this, and then I'm going to shout about it as loud as I can. And hopefully someone will listen to me and take me on, which is what you've managed to do, which is amazing.
Thank you.
Ursula, aside from everything you're doing in practice, you're also making moves into the educational space, which I think is fantastic. And we've heard already what a brilliant job you did at our BSDHT event this spring. And I just think that's so exciting for you and for us, because you've so much to give. Can you tell us a bit about what you've got coming up in 2025?
So I'm working with, as I said, Naveed, that has been doing the isolation course, or working on his isolation course, and I'll be working just as a demonstrator, just like helping out.
Brilliant.
And that's something I want to get into. I want to sort of see behind the curtain. Yeah. There's more to running a course than I anticipated. I think there's more to it than you really anticipated.
What has been your learnings from setting up?
Learnings for me, and I'm very much more feeding information and gathering information, is that there's a shocking amount of dental professionals that need courses, and maybe are nearly afraid to say that they need certain things. So for me, I find that, especially with the therapist end, I need very basic training, and I don't know what to ask for. And it's not that rubber dam's completely basic, it is technique sensitive, but they were nearly afraid to put their hand up and say, what do you do?
Yes. So because of that imposter syndrome or because of that worry, we're maybe more comfortable in saying, we're not doing therapy all the time.
Yeah.
You've heard my admission of not using a rubber dam since my assessment at uni. Whereas maybe in the dental side of things, there's that expectation that you do know what you're doing with that,
Yeah,
and maybe you don't.
And that's exactly it. Maybe you don't. And even for younger, sort of newer qualified dentists as well, they're maybe not having the same level of exposure, or the same level of treatment planning and treatments they're getting practice with. So for me, it was almost shocking to see the amount of people that were contacting me saying, God, I'd love to do this.
Yes.
And that was a big surprise.
Yes. Where is your course based?
So it's the Leeds course.
Yes.
Very much I'm in the background.
Well, Ursula, it wouldn't be happening without you now. Let's not hide our light under a bushel.
And so it's in Belfast, and details are out now at the minute. It's gone live for bookings.
Fantastic.
And very much, I can't sing his praises highly enough. And I know I'm banging on about my confidence and about support, but that was key to me taking that further and to getting into doing more restorative treatment. And definitely getting into the education side is something that I'd very much hope to get more involved with.
And I will link all of the course details if you guys are interested in Naveed and Ursula's course. I think is it the 24th of May?
Yes,
24th of May 2025, based in Belfast, and I'll link all of that if any of you guys want to book on, because we'll definitely have this going out before that
100%.
time. That's brilliant. For anyone listening who's maybe feeling a little stuck or unsure about their next steps in their career, what's something that's really helped you keep going, growing and moving forward?
Wanting to challenge myself, that's definitely something that I like to push myself and push the boundaries a wee bit. Now it takes me a while sometimes. I'll think about it for a while.
Maybe a slow burn.
But for me, it would be, an advice I would give is not to be afraid to ask, and ask the people around, ask your clinicians around you, what course do you like?
Yes.
Even just simple things like CPD, like what, did you find this beneficial, or direct me into, if you're thinking of developing more restorative skills, sometimes starting off with sort of very basic CPD before you launch into, I'm just going to book this course. Do a wee bit of background reading again and just refreshing your knowledge that's there. But definitely for me, it's challenging myself and pushing that boundary a bit, it's stagnating. And I do look,
because it's a very repetitive role.
It is. And you have to keep it a bit fresh as well.
Keep yourself excited for Monday.
Exactly. Monday is a hard day. And I've sort of learned as well to have a bit of crack with my patients.
Yeah.
And they're nervous. And if you're not confident or feeling a bit nervous yourself, that leaks out.
It does.
So for me,
like reading the room.
Exactly. And for me, it was more like I love a chat and I love a fun.
Yeah.
I'm great at it, like. And can be funny, or I'll hum to my patients. I'll sing to them if I need it.
I know, but it's like, once I've sang, I had a very nervous patient and we ended up both singing together the theme tune of Antiques Roadshow. It was brilliant. And it was like a really surreal moment, but that helped that patient so much, and I don't regret it. I'd sing it every day if I could help somebody,
And like even that wee interaction where I have a patient that'll come in and for some reason, I must have been watching, I think it was Phantom of the Opera, so I was humming Simpsons. And he was like, could you change the station items? Did he like Andrew Lloyd Webber? Fair enough.
Very good, very good. I love that person was right on your wavelength there. That was brilliant.
There's no problem. What do you fancy over the country?
That was brilliant. So just keep moving, keep pushing yourself, if I suppose is the big thing, isn't it, for us all, and try new things.
And not being afraid to. I'm not saying that, definitely don't work beyond your scope.
Oh no.
Look at your scope and push the boundaries.
Yes.
You haven't done a fissure sealant in 10 years. Well, try.
Yeah.
And I bought models on Amazon. Oh yes, I love that. They're great. And before I started into real patients again, I just started cutting cavities on them. So I bought like 10 of these models and just racked the teeth on them, just cut them through and made the mistakes on the models and looked at the box and looked at my cavity preps. And used that for isolation as well, putting down on a models You say it's easy enough, but it's different in the mouth. But even the likes of sectional matrix as well, I hadn't used any of this. I'd seen them, obviously you know what they're doing, you know what they're for, but the actual practical application was a wee bit scary.
I'll find some on Amazon and I'll link them in the description as well, because I think that's such a good jumping off point if you do want to get back into some cavity prep and some dental therapy within your scope if you haven't done it for a while.
And use the out-of-date composite. Don't be taking the new stuff.
Yes, don't take new composite or you will you will be in trouble, big trouble. So what's next for Ursula? Who's inspiring you right now, and what's the next big goal you're working towards in the dental field?
Inspiring me at the minute is the therapists around me. Yes, definitely. We have a great community. We do. We really do. And it sort of feels homely now and supportive. And that's very much that's something that I'm taking a lot of comfort from.
Yeah, so nice.
It's lovely. And hopefully we'll have new generation coming as well, and welcoming those as well, because what I would have found sometimes a wee bit of a closed shop. Yeah. Especially if there's no training in Belfast at the minute, so that's a way. But I found coming back from England, I don't know anybody. So I find that just that welcoming, open, chatty vibe with the therapist around us at the minute is brilliant. And I have to say that Emma very much inspires me, because it's that vision of whole human dentistry.
I love that. I love that holistic approach is unreal, isn't it? And that's really, oh my goodness, the things that we're doing now in dentistry in terms of a holistic approach. Whenever we think about the impact that periodontally your periodontal health has on the rest of your body, aside from any sort of dental therapy things, that's so exciting to me. I can't get enough of that. That's the reason that I'm getting up and going into work in the morning. So I absolutely love that.
And I love that. Even thinking back to the structure of my day, from I started there, we're doing diabetic screenings. Yes. We're doing blood pressure checks. We're doing weight checks. We're talking to people about their general health. Yes. And even this week with patients that you're not suitable for treatment because your blood pressure's a bit high. And in some cases very high. Yeah. But it's also able to direct those patients to the appropriate healthcare signposts. Healthcare's went a bit funny at the minute, and patients and people in general are a wee bit stuck as to where to go and who to talk to. And what we're finding is that we're a wee bit more open, so the conversation accessible, and the conversation doesn't have to be solely, yes, we're obviously going to talk about teeth and gums and general health and oral health, but sometimes those patients just need somebody to listen to them for 5 or 10 minutes without interrupting them. Yes, let they go talk about their health and talk about what's worrying them. Sometimes you're dispelling myth. So I heard this happens. No, actually, I should think about it in another way. But also easing their minds that there's things that the people are worrying about that they really don't need to be. And vice versa. There's a lot of things that people need to be worrying about that they're not aware of.
That are not on their radar at all.
And even the likes of the skin lesions. Yes. We're doing a lot of that. And we're seeing that tenfold. It's something that has definitely always been very focused on. We're not just looking at the mouth, we're looking outside, we're looking at the head. You're standing behind and you're able to see the top of the head where patients can't see their own head. Yes. And the amount of referrals that we have had through that process, it's a wee bit shocking. Those patients aren't being seen. Those people aren't being seen in general practice.
Yes, because you're not going to the doctor now routinely. It's not like that sort of, for all the things wrong with America, I do think they have a really good system in that you have your yearly check with a dermatologist. You get into the doctor no matter what every year, whereas there's some people that maybe haven't been to the doctor in 10 years, but they go to the regular dental appointment.
They can have a chat about it. And those things are scary in a way as well, because there's a lot being missed. And I'm not saying we're saving the universe and all, but we're trying. But we're helping out and directing those patients to say, look, you need to get this skin lesion checked. I've taken a picture of it, and we're going to photograph it again in 2 weeks, and we're going to send your referral off. We're going to contact your GP. It's having those wee conversations, and also reassuring patients and people in general public. It's okay to ring your doctor and ask for advice and help.
Not bother you.
You're not bothering them. You have to push through that boundary, and you have to push through that barrier to say, no, look, I'm worried about this.
And sometimes having our backing behind you.
Yeah.
To say, I'm worried about this, but also I've been into the dentist.
100%.
My dental therapist, my dental hygienist, my dentist is concerned about this.
I tell patients to blame me all the time.
Yeah.
I said, look, just blame me. Obviously not going to tell you any lies or tell you to tell them any lies, but just blame me. Say that I won't get going on about this. And he said, and I do have a patient that came in recently and said, I phoned the doctor and got through and got her appointment, and turned out she was diabetic, and
I needed to see that.
I needed that, yeah, and needed that push to get in. And she literally said that to her GP. My dental therapist won't progress she won't stop going on about this, and until I get progression with treatment and with the diagnosis, and just taking that in hand. And we're not doing the whole of saving people's lives, but you're making a massive impact in people's lives and in people's general health.
Yes.
And that's a big long-winded way of me saying that that's what's inspiring me.
Oh, absolutely. I think that's such an inspiration, and we need to keep doing that day and daily. And I'm so excited to see what's coming up for Ursula. I'm so excited to share with everybody the details of your fabulous isolation course with Naveed, and thank you so much for coming and being part of the podcast today. I loved it. Thanks for And that's a wrap on today's episode of Conversations with Dental Friends. I hope Ursula's journey gave you the spark you needed to think bigger about your role or your team's potential in dentistry. It's stories like Ursula's that remind us that career growth doesn't always mean a new job. Sometimes it's just about reshaping the one you already have. If you find this episode helpful, inspiring, or even just thought-provoking, I'd love it if you could rate, review, or share it with a dental friend who needs to hear it. Your support means the world and helps us reach more dental professionals looking to shake things up and move things forward. If you're curious about the isolation course with Dr. Naveed, I've popped the link in the show notes for you. I've also included some of the other courses that helped Ursula step into her full scope as a dental therapist. So if you're looking to do the same, they're well worth checking out. You can find Ursula over on Instagram at umdental_therapist. She's lovely, super knowledgeable, and I know she would be more than happy to chat if you've got any questions about integrating more dental therapy into your day-to-day. Don't forget to hit subscribe so you never miss an episode. And if you're not already, come hang out with us on Instagram. Let's keep the conversation going over on @Conversations with Dental Friends. And you can find me over there as well at Homegirl Hygienist. I'm Rachel. Thanks for tuning in, and I'll see you next time.